guys, your favourite and most entertaining chiropractor is back, and today we're going to talk about what is chiropractic and what is chiropractic at Complete Care Chiropractic. How many times can you say chiropractic in one video? You're about to find out. So, chiropractors, what do? We simply use our hands and sometimes some tools and accessories to manipulate your spine and other joints to help with pain and mobility. People always ask me, what's the difference between a chiropractor, a physio and an osteopath? Essentially, in my opinion, we should all be doing very similar things. If we were all working in an evidence-based way and following the evidence and using what we know, we would be doing similar approaches because we should all have some kind of hands-on, some kind of exercises, some kind of lifestyle advice, and some kind of mental health incorporation because your brain controls your body. One slight variation with chiropractic compared to the other two is our focus tends to be around that spine. Although that doesn't mean we only treat the spine, it just means that's what we learn the most. That's where we start our sequences because your spine is at the center of your body. So what do treatments look like? What can they include? Most of the time, a lot of chiropractors are going to do diversified adjustments. That's all that clicking and popping and cracking, those little entertaining videos that you watch on the internet, maybe some to come. That's the majority of treatment. However, it's not the only way. Me personally, in my practice, I like to use my hands for the majority of the big adjustments with most patients, depending on your contraindications. And then my favorite tool is an activator. I love me this bad boy. It makes a loud noise, sounds a bit like a staple gun, I always say. It's not as scary as it sounds. If you just pop it onto the joint where I'm trying to use it, it creates a short, sharp, fast movement, like a heavy poke, to create a little gap in that joint and make that joint move. You also might find me using something called a speeder board. This is like a little mini drop piece. So you can get benches that have these drop pieces included, and this sometimes is still useful as well, but I personally have a bench like that right now, so I use a speeder board for any drops that I need in the meantime. And that makes a loud bang back down. The idea in this, it takes a little bit of that pressure out as I do that push and just helps your body move with the movement, keeping you mobile. I also sometimes use some things called blocks. These are little triangles like this. I pop them underneath your hips in a little bit of a wonky fashion to help straighten out that pelvis and get you back in line before I've even touched you, really. I occasionally drop them on the floor, sorry. Use some needles, some acupuncture needling. So I don't personally do acupuncture as in the Chinese medicine, but I do dry needling, where I might stick one of these little needles, to be fair, these ones are quite big, into a couple muscles to help it relax a little bit faster. I also do some mobs with my hand, move those joints around, and I might not do those big diversified adjustments depending on what's going on with your health. So we might do some mobility work, just simply moving those joints back and forth. And then of course we do some soft tissue work, a little bit of massage here and there. I'm going to poke in all of those sore spots of your muscles, help relax that down and get it a bit more stretched out. I also sometimes use a massage gun. This just vibrates, beats down on those muscles and does that massage a little bit faster and for me. Takes out the hard work for me, essentially. Other chiropractors might use some other tools as well. Sometimes you see people using ultrasounds, all of that kind of jazz, and variations of the activator. You have electric versions, all of that jazz. For me, that's about it. The only other thing I will do is use my mouth. I'm a yapper away. I'm going to find out what's going on in your life, give you some lifestyle advice, some hints and tips. How might we change your sleep? How might we change your desk space? What can we do to make it so that pain builds up a little bit slower and adapt that life to suit you better? We're also going to give you some exercises. Might give you 2-3 exercises the first time you come in and get you to do them every day. We could add a few as we go through. I tend to not overload because realistically, you're just going to lie to me about doing them anyway. The last thing that goes into my treatments at Complete Care Chiropractic is the mental health approach. I take a very mental health approach in everything I do because your brain affects your body and is constantly in charge of what's going on. If you believe badly about your body, it's going to listen. So my goal as soon as you walk in that door is change your beliefs about what's going on in your body and understand that your body is strong and able to heal itself, and I'm just here for a helping hand along the way. So that's about all for today. Hope you feel like you know a little bit more about what chiropractic is, and especially what chiropractic is over here at Complete Care Chiropractic. Apologies for the chaotic video, but honestly that's just what you're in for over here. So thanks, and I'll see you on the next one.